Welcome to Health Corner. I'm Dr. Fackrell. Tonight I'm going to talk about dehydration with little children specifically. Children are it's always a scary thing when a kid is sick. In fact, if they get sick, one of the things that we watch for carefully is hydration, because if they do get dehydrated, that's one of the things that can kill them. In fact, in a lot of the developing countries, or the third world countries rather, that's one of the most common killers is dehydration, so we've got to watch it carefully. In fact, even when I was a resident in Fort Wayne, Indiana, my little girl was sick, and I watched her, and over the course of a day or two, and she decreased her drinking, and as I realized how low she really was, it was pretty serious. We had to get her in the hospital, give her IV fluids, and luckily she did survive, but it's something we definitely worry about. Jessie, the PA student who worked with me in the past, is going to spend some time and talk about dehydration, especially with little children, some of the signs and symptoms and things that we can do to help with that.
Hello, my name is Jessie. I'm a PA student, as Dr. Fackrell said, and today I'll be talking to you a little bit more about dehydration with little kids. So dehydration in general, with adults or children, happens when you don't have enough water in your body. So you're not drinking enough water. You're not drinking enough to keep up with how much your body is putting out. This can cause problems. It can cause electrolyte imbalances. It can cause your heart to have issues with its rhythm and cause dysrhythmias. And eventually it can even lead to death. It can become a very serious problem. In children, they are even more susceptible to dehydration because they have a higher metabolic demand. In other words, they're growing, they need more water, they need more food. Children also tend to lose fluid more easily because they have a greater metabolic demand. They have an increased baseline level for water needed in their body. But little children are little. They have a smaller amount of body surface area, which means they require more fluid for less body. Worldwide, dehydration is a high cause of morbidity and mortality in children. This means that worldwide, dehydration is a big cause for death in children. So it's something we definitely need to keep our eye on and know the signs and symptoms, which I hope today will be helpful in teaching you about the signs and symptoms and what to do with a dehydrated child. What are the most common causes of vomiting in children? Well, the first one is gastroenteritis, viral gastroenteritis. And that just means that they have diarrhea and vomiting from a virus. Many of you have had this. In fact, I feel like all of us have had this at one time or another. But with kids, it's really scary. You need to keep an eye on them and make sure they don't get dehydrated. A second cause of dehydration in kids is gastroesophageal reflux disease. This just means a really kind of severe case of heartburn. And it can oftentimes cause them to spit up more. So we need to keep an eye on it. Other important factors that can play a part in dehydration with little kids and more emergency type situations include pyloric stenosis. Pyloric stenosis is often seen with children that have projectile vomiting. So projectile vomiting means that they throw up, but they throw up and can hit the back wall. This is something to keep in mind when you have children that are dehydrating. Another cause is intussusception, which we discuss later. It's very common with 2 to 3 month old. Other causes include excessive sweating. So if you've noticed that the child sweats a lot more than the average kid, they're at a higher risk for becoming dehydrated. As with adults, it's the same principle. And burns. So if you have a child that's maybe suffered some severe 3rd-degree burns, or even a sunburn, it's going to increase their risk of becoming dehydrated. So just another thing to keep in mind. Now burns make sense because when the skin is burned, the skin, first of all, functions as a barrier, not just to the outside world, but to the inside. It helps keep moisture in our body. So when you've burned or destroyed that skin layer, you're not going to be able to keep fluid in like it normally is. So just another thing to keep in mind with these kids. If they have burns, they're going to be at increased risk of becoming dehydrated. What are the signs and symptoms of dehydration to look for? These include absence of tears, fewer wet diapers than normal, darker colored urine, maybe dizziness or lightheadedness, obviously nausea and vomiting because that's what's causing the dehydration most commonly. If they've been sweating, their sweating will stop, and abdominal cramping will happen often. Following symptoms are red flags. That means these symptoms are very important, that if you notice these, you need to contact a medical professional, a doctor or a PA, or get your child into a hospital soon. The following symptoms include mental confusion, weakness, lack of energy, lack of enthusiasm, and obviously the worst, loss of consciousness. I think something very important to be able to do is to assess your child's symptoms and be able to correlate that to the severity of how dehydrated they are. So I've included a table that kind of helps outline this and will help you determine mild, moderate, or severe dehydration with signs and symptoms that your child may have. As you can see, this chart divides the severity of your child's dehydration into mild, moderate, and severe categories. In the mild category, a thing to look for is slightly dry mucous membrane. So look on the inside of their cheeks, it may be slightly dry. They may have an increased thirst, so you notice they're drinking more water and wanting to drink more water or fluid. But in conjunction with that, they may not have as many wet diapers or may not be going potty as often. So just pay attention to those. Moderate severity, again, you'll see the dry mucous membranes. Their heart rate's going to be increased, but that's a little bit harder for you to tell when you're at home. That's something we more look for when they come in to us for help. They will have, again, little to no urine output. They're going to be tired, weak, not playing as much with the other kids. Their eyes might look like they're sunken, and their fontanelles will look like they're sunken. Now, fontanelles are where the sutures in the skull haven't quite closed yet. And you'll see these, often people call these the soft spot on the top of their head. So look at those and see if they're sunken in more than normal. They also may have a loss of skin turgor, and that just means the elasticity of their skin is not normal. You can actually just slightly pinch their skin and it will raise their skin up. When you let go in a normal skin turgor test, the skin will actually fall back down to normal. But if your child is dehydrated, then that skin will stay up and you can actually see where you pinch their skin. This is also called skin tenting. In severe dehydration, again, same symptoms as moderate. They're not going to have tears. They have cyanosis, which that just means that you may look at the mucous membranes or their lips or just the color of their skin, but especially their lips will be like more blue/purple in color. They may be breathing faster. This is because the electrolyte levels are off and the body is trying to compensate. They may have a delayed cap refill, and that just means if you push down on their little fingernail and then let go, you'll notice that you made it white when you pushed, and then immediately a pink color comes back. Well, normal cap refill is less than 2 seconds, so when you push down on their fingernail and let go, that pink color should return in less than 2 seconds. If you notice that it takes longer than 2 seconds to show up, that pink color to come back on their fingernail, then you know that they are probably pretty dehydrated. Low blood pressure, again, that's hard for you to check. That's something we more look for. And mentally, they might just not be as alert or awake as normal. So hopefully this chart helps you, and I would keep it as a reference. Go ahead and pause the video if you need to write down any information, but look for these things and try to categorize your child so you can get them the help that they need if they are in need of IV hydration. With with dehydration, especially with viral gastroenteritis, so they're throwing up, they're having diarrhea too, they're not just losing water, they're losing electrolytes. And an electrolyte imbalance in the body can become very, very severe and can be a bad thing. It can cause heart dysrhythmias and eventually death or cardiac arrest, which means the heart stops because of the electrolyte imbalance. So lab tests are really important. Obviously, if you have a child that is moderately to severely dehydrated, you need to get them in so we can test their labs and see where they're at and make sure that we get those electrolytes balanced again like they need to be. So the best thing to do with a dehydrated kid is to give them fluid. And this is best done orally, or in other words, have them drink it. Small amounts are best, and electrolyte replacement fluids are the best. A brand of this would be Pedialyte, but there are many other brands out there. Just look for them. They should be in your pharmacy section of your local grocery store. So when do you replace using oral fluid? Mild to moderate dehydration, it's important to use these electrolyte replacement fluids. These are effective, they're safe, and they're a lot cheaper than IV hydration. Frequent small amounts of fluid are better than large amounts at one given time. This helps reduce abdominal cramping, which if they're already throwing up and having diarrhea, it's going to reduce the chance of them throwing up more and causing more problems and further progressing that dehydration that started. As I mentioned, these oral electrolyte fluids or solutions are available at your local grocery store in the pharmacy section. They can come in a powder or they can also come pre-mixed. It's important to read the directions on those powder ones. It will help you in mixing that and getting the correct amount or level. And I also would think it's a really good idea to keep that at home in case your child gets sick, so you have it on hand in case they need it. Sports drinks, juices, and similar drinks in that nature are not recommended for children or adults, for that matter, who become dehydrated. You may be thinking, well, why? It's fluid. It would be helpful. Well, when they become dehydrated, the body actually has a natural process or a ratio, if you will, of normal electrolytes. And all of those drinks I mentioned, sports drinks, sodas, juices, have the wrong ratio. They generally have too little sodium and way too much sugar. This throws off the ratio in the body, and it actually can cause additional fluid loss, which contributes to dehydration with those little kids. So that's something to keep in mind, and that's why we recommend those specific oral electrolyte fluids. While you're giving these oral rehydration solutions, it's important to, with those children that are still breastfeeding or bottle feeding or formula feeding, to continue eating. You want them to still be fed with the proper nutrients that they need if they can tolerate it. Also, if you have a kiddo that's eating regular foods, it's important to get them eating too when appropriate, when they've stopped throwing up. This will help them recover as well. They need the proper nutrients for their body to heal and get better. So how much of this solution, specific solution, should you be giving to your children? You may be wondering this. I know I was when I was researching this topic. And a good rule of thumb I looked up and found was that 1 to 2 tablespoons every about 5 minutes, 3 to 5 minutes, is very appropriate for your child. Again, these small frequent amounts help decrease abdominal cramping and hopefully can prevent them from, again, vomiting all this up and kind of undoing what you did with the oral rehydration solution. If you're still in question about this, feel free to call your doctor or your PA. There's actually a formula that they can come up with a specific amount that you need to be giving your child based on their weight. So give them a call if you have any question or any worry, and bring your child in again if you have any question or worry. If your child is still vomiting and still has diarrhea, continue to give them little sips, little tablespoons of this solution, even as after each vomiting episode. This will help prevent them from dehydrating so quickly. Let's say you get your child so he or she is not dehydrated anymore, and then they start to throw up again and have diarrhea. Well, then you want to continue with the same schedule that you did before. You want to continue with this oral rehydration solution for at least 3 to 4 hours to get them rehydrated again and get them back to where they need to be. So when does your child need IV rehydration? When is it appropriate to take your child to the hospital to get IV fluid? When they have severe signs and symptoms of dehydration is when this needs to happen. Also, if they're moderately dehydrated, but they cannot quit vomiting, it's a good idea to take them in to get that IV rehydration. Also, when you take them in, the doctors and PAs can help give medication that can prevent them from vomiting as much or completely stop it altogether so they don't become further dehydrated. Again, if you have any questions or concerns, or you feel that mother's or father's intuition that you need to take your child in, don't hesitate. Take them in, bring them to your doctor or your PA, and we'll be glad to help you out and get your child on the right track.